Welcome to this edition of the Taiwan Outlook. I'm your host, Raymond Wu. Healthcare is a universal concern. For those of us in Taiwan, that is no exception. Although Taiwan's healthcare insurance system has been well documented as a model of success, there are still many areas of concern and problems that need to be explored further. And that is the theme today on the Taiwan Outlook. We're very pleased and very honored to have a special guest to be our speaker in the program today. And that is Dr. Andrew T. Huang, who is the president and CEO of the Koo Foundation Yat-Sen Cancer Center in Taipei, Taiwan. Dr. Huang, welcome to the program.
Dr. Wu, thank you very much for inviting me to the macro view.
Yes. And Dr. Huang, before we started the program, we were talking about your diverse and very rich experience in medicine, both in Taiwan as well in the U.S. Maybe I can start off the program by asking you to tell the viewers back home a little bit about your experiences both in Taiwan and in the U.S. as a doctor and also a hospital administrator.
Thank you. I was born in Taiwan in 1939. I finished my medical school at the National Taiwan University in 1964. Mm-hmm. And after a year of service at the Chinese Air Force, I then went on to begin my residency at the University of Pennsylvania in internal medicine.
Very prestigious school. Yes.
And after 2 years or so of training, I then went on to Duke University in North Carolina and have remained there ever since.
Really?
So I've been at Duke University first as a trainee, and then in 1969 I was asked to be on the staff. This has been a very productive part of my life.
Yes.
And in 1989, I decided to come back to Taiwan to serve the Society of Taiwan.
Yes.
Although during this time, I continue to go back to Duke to teach 4 times a year.
So you fly back and forth.
So I sometimes I'm in the U.S. teaching something, and then the next moment I'm back in Taipei teaching students from here, residents from here, about my experiences, both in Taiwan and in the U.S.
And I know the systems may have a lot of similarities, those in Taiwan and those in the U.S. But what's your overall view and feelings about the medical care in both countries in a very general sense?
In the U.S., you can see very clearly the respect for life. And that is strongly expressed at all levels, from the standpoint of the health professional and also from the standpoint of the society.
Yes.
So they're willing to invest in the education and training of health professionals. They also are willing to allow them sufficient time to look after their patients. There's a pretty strong emphasis on public health as well.
Yes.
So, for example, the infectious diseases are much less of a problem there than we see here. By comparison, I think the public education has room for improvement here, and so there's the public drive or push to improve healthcare, quality of healthcare is also leave room for improvement.
Yes.
But I think because Taiwan and the rest of Asia had been affected by poverty.
Of course.
And so healthcare was really never an emphasis until the last maybe 20 years or so.
Yes.
When Taiwan went from rags to riches.
Yes.
And started to have a continuous improvement in our per capita GDP.
Yes.
So I think most people now are paying much more attention to healthcare than they used to.
Exactly. Yes. And one of the many areas that often people criticize in terms of healthcare providers is the so-called doctor-patient relations. And you being a doctor in both the U.S. and in Taiwan, especially in your experience in Taiwan, what do you find are the major issues and areas of criticism that you hear from both doctors and patients on this very important and delicate relationship?
In the U.S., through the education, there's a tremendous emphasis on patient-doctor relationship.
Yes.
Here I say patient-doctor relationship instead of doctor-patient relationship because I think patients are more important.
Yes.
And so during the course of training, we're constantly reminded of the need for respecting patients,
exactly.
patients' family, patients' cultural background, and patients' needs. Here, the tradition is somewhat different. Physicians are, in general, better educated. And so when they talk to the patients are, of course, not sophisticated in medicine, so are usually on the receiving end.
Yes.
And the physician-patient relationship is sort of a relationship between an upper hand and a lower hand.
Yes.
And that hasn't changed very much since I was a student here.
Okay.
So one of the first things I wanted to do is to change that.
Okay.
By telling our residents to put more, spend more time and emphasis on
the patient's needs. Yeah.
Getting to know the patient better. So knowing the patient is actually the first step toward any kind of healthcare delivery.
And do you think that today's medical students in Taiwan and also the residents have realized that it's more important to be paying more attention to the needs of the patients and their families, and also become more compassionate in their delivery of medical care? Is that being awareness?
I think they are confused.
Really?
While we emphasize patient-doctor relationship,
yes.
we wanted them to be compassionate,
yes.
to be kind,
yes.
To be always aware of their the asymmetry of understanding of health affairs.
Medicine, yes.
They are confronted by just the opposite, that their senior physicians are seeing large number of patients in a short period of time. So each patient is given only a few minutes
That's right.
of care. And when they see this, they say, well, how can you relate to your patient well if you spend only less than 5 minutes per patient? And so they are confused. They don't know whether the senior physicians are practicing the way they preach. And I think this is the reason why they're all confused.
Yes.
And so on the one hand, they feel very strongly that a physician's job is to take care of patients. On the other hand, they see senior physicians doing just the opposite.
Okay.
So the society has to change.
Yes.
The culture has to change, and before we can see a respectful life and respect for patients' needs.
And in addition to educating the physicians, the medical students, are there things that you would suggest that patients, the average citizen, as patients, that they can do, maybe be more realistic in terms of how to deal with their physicians, and be a little more respectful of the kind of remedies they received? And are there other areas that you could identify that will help this relationship to get better?
Oh, I think the society needs to invest more in public education about health.
Okay.
Our children grew up being taught where the organs are and what they're when they become ill, what they ought to do. And so this starts at age 3.
Yes, very young. Yes,
very young. And here, even at the PhD level in Taiwan, most PhDs don't know enough about their health. So there's a tremendous discrepancy. So I think there's a dire need of our society to invest in public education about health. And how do you do that? I think the government has to start.
Okay.
And instead of just relying on not-for-profit organizations to do the job. In the U.S., of course, many of these not-for-profit organizations exist.
Yes.
And they do really beautiful jobs. But here we have very few of them, and they are not, well endowed.
Yes.
So we really need to get the government to start, to have a kickstart, so that others will then follow.
Yeah.
And I feel the education of health professionals, while very important, the education of the public, of the citizens, perhaps at this point in time, is even more important.
Yeah, I would tend to agree because, like you said, when we were little, we were taught that if any small problems that we have in terms of feelings or health, then the first thing we do is go to see a doctor, even if it's just common cold. But that's a very wrong concept, isn't it?
Right.
Yeah.
Well, we need to know enough about our health.
Yes.
So that we can contribute and participate in the care of ourselves, rather than being told what to do.
Yes.
We actually, it's our health that matters.
Yes,
it's not physician's
exactly.
health. So when you meet with charlatans, you know that he is a charlatan, and you don't really need to listen to him too seriously. Public education in the U.S., on the other hand, is extremely good.
Yes.
So, patients who come to you with online material, database to discuss with you about how their illness ought to be managed.
Yes.
We see this here now.
Yes. Starting to see
just beginning,
that.
right?
Yeah.
And I think that's good,
Yeah.
but we ought to encourage that. And also, I use email to discuss with my patients.
Yes.
Because that's a very effective way, especially when you're abroad.
Yeah.
And sometimes they can't get hold of you by phone.
Yeah.
But email will get to you.
Yeah.
With
Just
certainty.
as easy. Yes.
And so I would encourage that there's a more investment in
public
education through online home pages.
Yeah. One thing, like I said at the beginning, is that Taiwan's universal health insurance system has been well documented as a success. But is it really a success, or is it there's a lot of room for improvement still? You take a short break. We'll be right back to the Taiwan Outlook.